Welcome back. Health officials are sounding the alarm as whooping cough cases dramatically increase across the globe, in China, in Europe, even parts of the United States. Pennsylvania has seen an uptick in the potentially deadly infection, especially among children. Dr. Jen Caudle is here to tell us more. Dr. Jen, welcome back.
Thank you. Good to see you.
Good to see you as well. So what is whooping cough and why is it coming back in such strong numbers?
Yeah, so whooping cough is something that I think that a lot of people don't realize is actually very relevant today. It's a contagious respiratory illness caused by a bacteria. The thing about it is that, it's spread through upper respiratory droplets, coughing, sneezing, things like that. And at first, whooping cough can seem like just a cold. It can seem like just your average run-of-the-mill cold, but it can become really, really dangerous, especially for like little babies and young kids. It's one of the reasons why the fact that these numbers are increasing in some cases is really problematic.
What are the symptoms we should be looking out for?
Yeah, so there's a number of symptoms, right? Again, so a lot of times the symptoms start out as sort of just cold symptoms, runny nose, things like that. But what happens after time is that people usually get sort of these characteristic coughing fits. And oftentimes these coughing fits will cause people to sort of make a high-pitched whoop sound. That's the whoop of the whooping when they're able to sort of get a breath in at the end of the coughing fit. Sometimes these coughing fits can be so violent that people vomit. They often feel very tired, and the cough can be very incessant. The problem, though, is that when kids that are really, really young, sometimes they don't get that necessarily. They just may actually stop breathing, have trouble breathing. And again, that's an indication of really serious problems. It's one of the reasons why we worry about whooping cough in younger people.
Dr. Jen, any way to prevent this, especially when it comes to young kids?
Yeah, awareness is really key. But when we talk about awareness, we're really talking about getting vaccinated. The good thing is we have vaccines. Now, really, really young babies are not able to get the vaccines, but they are as they get older, which is one of the reasons why the rest of us need to make sure that we are up on our vaccines. So, for example, it's recommended that pregnant women get a vaccine to help protect their baby. So that is a recommendation that gynecologists and the CDC recommends, et cetera. But also everybody, adults 19 years of age and older, should get a Tdap, TDAP. That's a vaccine that's got tetanus, diphtheria, and acellular pertussis. That's the whooping cough part, at least every 10 years. And you know what? As if you have young grandchildren or people coming into the family, babies that are coming in and being born, you really should be making sure that your vaccines are up to date. So there are things that we can do, and just being aware, right? You got unusual symptoms that aren't going away, you make sure that you seek medical care.
Thanks for watching. Go to joinnn.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.